All right. Well, hey everybody. Hope everyone's doing well today. So we're going to start our weekly Tuesday webinars, and today we're going to talk about post-concussive migraines. So I'm glad that a lot of you were able to join this, and we're also going to be sharing this as well. So I'm going to talk about some of the areas that we're going to share and some resources. But I wanted to kind of talk about more on post-concussive migraines. This is definitely a topic. I've talked about migraines in the past. I actually wrote an article on post-concussive migraines for the Brain Health magazine. So I wanted to I'll give you that reference here in a second. But what I was actually kind of thinking about for this Tuesday webinar was, I did this, I did this piece on post-concussive migraines for the Brain Health magazine. But I was thinking, it'd be kind of cool to actually talk on it. So it's one thing to put it in words, but to actually kind of just talk on this topic and give some, information behind it could be really great. So those of you who have actually read, this article, now you can listen to me actually talk on it. And so we can kind of banter back and forth and give you some more information that's in my head that's, easier just to talk about versus, writing it all down. So a little bit about me, if you're not familiar, so I'm board certified chiropractic neurologist. I also have a board certification in nutrition as well. So that's kind of the big crux of our practice is we utilize what they call functional neurology. So understanding how the brain works, how it integrates with other systems. And we combine that with, kind of more of that functional medicine side. And we really pull those two worlds together to help understand some of these really complex cases. And migraines is actually really kind of a classic example of where those two worlds meet. And so during this presentation, I'll kind of touch on that and explain to you like some of the functional medicine aspects behind migraines and then some of the neurological pieces. But today we're definitely going to focus on the post-concussive migraine. So that's kind of a little bit about me. I've actually been trained in TBI Rehab, as well as getting my neurology certification, and I've been in practice now for 17 years. So this was, this is the Brain Health magazine that I was referencing. So this was, I actually put the link on there for the article that I wrote in that magazine. And it was a lot of fun. So I'm really appreciative of Amy Zelmer, letting me be a part of that magazine and that issue. So we'll be doing more from our office, to contribute into the magazine. So you'll be hearing some stuff from Dr. Perry Maynard, Jake Meyer, who's our counselor. So we're going to be doing some things to help contribute to this. It's been a lot of fun, and we're happy to be a part of it. So kind of an introduction to this, where I'm going to go with this is I actually have my article posted. So I want to reference some of the pieces in the article, talk more about those pieces, kind of go off on tangent. And we'll do this for the next, 35, 40 minutes or so and give you guys some really great information. So to kind of start this whole thing off, I was really looking around when I was writing this piece and kind of found some really interesting information out there that, and this is the article that I kind of referenced if you guys read through that article, but this was the very first article that I referenced. But in the article, what they talked about is that they noted that new or worse headache prevalence remained consistent at least 33% of the participants at 60 months. One of the things that was really interesting about post-concussive migraines is that they're really starting to look, 3 months out, 6 months out, 12 months out, and then even up to like 5 years. And they're finding that, if you don't figure out what's going on with the migraines, or you don't figure out where this is coming from and how to get rid of them, you can end up developing migraines up to 5 years post accident. So we do hear these things when we'll say, ask people, well, when did the migraines start? Well, it started a couple of years ago, but I used to get one here. I would get another one here. So it wasn't a big deal. But then as the years progress, they get more and more and more. So we'll hear people talk about, once a month migraines, and then they'll go to like twice a month, and then once a week, twice a week, 4 times a week, 5 times a week. And then it's all the time. Especially when we start talking about signs and symptoms, migraines can last from 4 hours to 72 hours, so 3 days long. So if you have 2 migraines in a week, that could be up to 6 days. So 6 of the 7 days you have some pretty severe pain that keeps you from functioning. So I thought this was interesting, and they're looking at testing people, 6 months, 3 months, 12 months out, and finding that people still have migraines. It's just really becoming an epidemic of people that aren't being, I don't think, treated very well. Is kind of my opinion, where they're not being treated, identifying the cause, and getting rid of the migraines. The migraines are tough. I mean, there is no doubt about it that migraines are tough. And I can tell you some of the awesome stories that I have, but I can also tell you some of the stories that have just kicked my butt. And I think, in my opinion, any good practitioner, they can tell you all the successes, but you also want to hear, they've also failed. Nobody is 100% successful. And when I think, when it comes to migraines, that is definitely one of the areas that you can have some great successes, and your head could swell like a balloon and you can't fit through a doorway because your ego is super big. And then you can go to the next patient and your ego is popped and deflated, and you just want to quit for the day. So this is kind of how migraines work. So they're not easy whatsoever. So I think anybody who says, "Oh, migraines are easy, I can fix them," I might want to kind of run and look for somebody else. Also in the article, I kind of referenced that, it was the American Headache Society. Dr. Vargas states that following concussions, 95% of people are likely to experience headaches. And among those headaches, roughly 2/3 of them will have migraine-like symptoms. So it's kind of interesting. 95% of people can have headaches. So that's a lot. And even when we looked at TBIs and we looked at auto accidents and slip and falls, most everybody does talk about having a headache. So for some people, it goes away. For other people, it turns into migraines. And then for other people, they don't really get the migraines, but they have this chronic head pain or headache. And those can, well, I'll back up. What we see a lot with those patients is that it turns into like a chronic pain. And those can actually take a lot of work to get rid of as well, because once you get into a chronic pain cycle, that pain just lingers and lingers and lingers, and it doesn't take much to turn it on. So an analogy that I like to give is that you'll see, well, let's back up. So you have a fireplace, and when you're trying to get that fire going, whether it be at a campsite, in your fireplace, the charcoals in a barbecue, it feels like it takes a lot of work and a lot of energy to get the fire going. But once the fire is going, that is the best. It doesn't, all you have to do is put an extra log on the fire and it's just going. You put an extra log on the campfire, keeps you warm. Once you get the briquettes or the charcoals going, then you just want to cook meat all day long because it's so easy. And that's kind of how chronic pain is that it could take a lot to get those things started, or it can take an injury to get it started. But once it's going, it doesn't take much. So it can be a tight muscle, it could be compensation, you can bump your head slightly, you can sleep wrong, you can sit in a chair wrong, but it doesn't take much to turn it on. And so this is when you get into these chronic pain syndromes and chronic migraine syndromes and people that are just really struggling. So it's really kind of fascinating, some of the research that's gone on with this. And that's why I wanted to kind of touch on this with the magazine and then do a webinar today, is that I think there's a lot of you guys that are suffering, but there is still hope, so you just have to figure out, how do we break the chronic pain cycle? How do we break the chronic migraine cycle? What are all the different triggers for it? And that's why I'm going to hopefully give you guys some of those thoughts today that you can kind of work through on your own, or find somebody who's really good at this subject and see if they could be of great help, or maybe reach out and see if we know anybody in your area. So these are all some different resources that hopefully we can help you with. So the signs and symptoms. So if you've ever had a migraine, definitely these signs and symptoms are very, very common to you. It was actually funny. I was talking to a patient today. He's got some neurological issues, but they're more degenerative. But we were actually talking about migraines, since I knew I was going to talk about this today. And he goes, "Well, I've been fortunate. I only had one migraine in my life." And I'm like, "Man, that must be nice, because that's not the norm." So a lot of people have experienced these things of unilateral headaches, light sensitivity, sound sensitivity, nausea, blurred vision, dizziness, fatigue, anxiety, depression, and the list kind of goes on and on. But you get this wicked pain, you get this massive pain that people will talk about feels like an ice pick behind their eye, or they feel like their head is in a vice, and they have this massive pressure, or they feel like their head is going to explode, or is throbbing, or somebody like lit a fire like inside their skull and torched it. And I forgot to add it to this webinar, but there's actually some really cool migraine art out there where people who suffer from migraines actually have art that they've made. And so kind of almost describes or depicts what they experience. And it is fascinating. So I've actually given migraine talks in front of neurological practitioners and included those art, and it's super cool. So if you ever get a chance, type in migraine art in Google, and some people can go, that's exactly how I feel. So some people put it into art and words, and it's kind of cool. But the signs and symptoms are not, and they're very debilitating. We hear people that say they live in a cave. I actually had a patient that she had a quote unquote cave in her house, and that's where she went and hid out every time she got a migraine, and she would have to call into work. She couldn't do things with her family. It even got to the point that she was actually utilizing our counselor because she had had migraines for so long that just being a part of her family, she didn't really know what that was like anymore. And even her daughter was like, I don't know who my mom is because I know she lives in a cave. So some of these people, it is so debilitating what they go through. That it's nothing funny. There's no joking. It's serious for people who struggle with migraines. So you do hear these cases where ever since my concussion, ever since my TBI, I've been struggling with migraines and nobody knows what to do. I've even had patients myself that I've gotten all their brain symptoms better. I've gotten their objective findings better. And then the last thing that I just struggled to get rid of was their headaches. And eventually we got them, but there was times that it just took forever to get those under control, even after we got their TBI findings to normalize and get their brain working better. So what you kind of see with migraines, there's a lot of compensation. There's a lot of pieces involved. It's not simply black or white. If it was, I think coming to practice and working on patients would be super easy. Now, I want to kind of touch on a couple things. One of them is auras, and if you don't know these, they might be helpful because auras can sometimes tell you, hey, something's about ready to happen. Auras also are great because they give us as practitioners an idea of maybe where the migraine is taking place. So here's a couple examples. Well, not examples, but just giving you categories. One of them is like visual changes. So people will talk about like squiggly lines, tunnel vision, spots, all sorts of different kind of visual pieces, sometimes even like hallucination types of visual changes. So some of these things give us an idea of what's going on with different parts of the brain, whether they're squiggly lines, hallucinations, or bright lights in their vision. Auditory changes could be things like hearing a train go by. Those are probably some of the more common things that we hear, or sometimes tinnitus, where you get the high pitch or low pitch sounds in the ears. Those could be some auditory changes. Changes in smell. We'll hear things like, I smell orange, I smell fish, I smell grapes, I smell burnt wire, I smell coffee. Changes in taste and sensory changes. Sensory changes could be like tingling in the arms, tingling around their lips. Things will itch, parts in their body will itch. And one of my patients a long time ago, she knew that she was going to have a migraine because she would get tingling that started on her fingers. It moved up her arm into her shoulder, and then once she knew that once it hit her lips that she was about ready to have a migraine, within the hour. So you get these auras, and in an aura, a lot of people ask, well, what are those? Some people have talked about this, and it's kind of what I've understood and kind of the description I like. But auras, when you have a blood vessel that constricts, you can have this slight moment of what they call like anoxic depolarization, which means that you don't, for a split second, you don't have oxygen. And so that part of the brain that kind of, for lack of better terms, kind of like freaks out or says like, what's going on? And so it turns on, and you get this sensation within that part of the brain that then manifests. And then afterwards, you get a throbbing sensation. So the blood vessel will dilate, and you get these throbbing kind of whooshing sounds, and you have pain that goes around these blood vessels or pain fibers. And so now you can get like this pain syndrome, the throbbing, this whooshing, and then everything is kind of set into motion. So that's kind of what you see, but not everybody gets migraines or auras, sorry. So some people get auras and some people don't. And even in the ICD codes, so the coding the medical codes, they actually say migraines with auras or migraines without. So not everybody gets these, but for some people, they can be helpful because you know one's coming. So it's almost like a warning sign. So now we come into prodrum. So when you look at a whole like migraine event, you actually start with a prodrum, and then it can have an aura, and then you have the attack, and then at the end you have what's called a postdrum. So the prodrums are usually a few hours. They can even be days before an attack, which is kind of crazy to think that you can have an attack, or you can have a prodrum on Monday, and that tells you that you might have a migraine on Wednesday. But there are people that have those. You can see changes like irritability, depression, all of a sudden craving food, craving certain foods, craving sweets. You can have sensitivity to light, changes in your speech, difficulty with focusing. So these are some of the things that people will talk about. Like they almost know. These are kind of your warning signs. So if all of a sudden you're like craving a certain food, you might go, oh no, this is going to turn into a migraine. Or if all of a sudden you can't focus and your speech is kind of changing, that can also be an indicator of a migraine to come. So then you go through the migrainous attack. And if you remember, I was saying like migraines can be 4 hours up to 72 hours. So they can be a long time. So you kind of pray that you get the shorter one, but there's a lot of people that's usually about 24 to 48 hours, I would say is probably the most common average that I see. So the post-ROM is kind of like the same thing that you hear with people that have seizures, where you have like this post-ictal phase where you have a seizure, then afterwards they're kind of like blah, they have fatigue, they can't really function or focus. They seem like they just need to sleep all the time, sleep it off, or they have kind of slurred speech. You actually can get these same things with migraines. So people that once you have a migraine, they need to like go take a nap, they have to sleep it off. They sometimes will have mood changes like depression, but sometimes people feel euphoric. It's really kind of fascinating. They can have difficulty with focus. They're very sleepy. There's just different kind of post-ROM, phases. And so a lot of people with migraines know this because once the migraine stops and they're like, well, my after effects or the aftermath will last for, another couple hours or another day. So it's kind of crazy when you look at the entire like migraine event. The migraine event can last all the way from, like that 4 hours into like days. By the time you get through the predrome or the prodrome, aura, attack, and postdrome, you're looking at days for some people. And so even having like one migraine a week can be very debilitating. So these are some of the things that if you've experienced migraines, you know exactly what I'm talking about. If you have a loved one with migraines, this is kind of what they're struggling with. And I think sometimes to give the education, help some of the caregivers go, okay, I have it. Or as a caregiver to watch out for these signs and symptoms, because then sometimes you can ward it off. So if you can identify what's a trigger, let's say somebody starts getting tingling around their fingers, and that's an early sign of a migraine. If all of a sudden the person you're caring for says, hey, I'm starting to get tingling, you're okay, what just happened? Did you eat something? Was it stress? Was it hormones? Was it a change in the weather? Was it a full moon? What the heck happened? And sometimes if you can figure those things out, then you know how to head those off. Or if you do have like a migraine drug or an abortive drug, sometimes that's when you can actually get those drugs in before the migraine even occurs. And then you're actually making some headway, because every time that migraine kicks in, it just causes more pain, and it kind of makes that system more sensitized. So it's like having a fireplace or a barbecue pit that is just primed and ready to go. So we don't want to keep that fire pit going. We want to keep it off, so that makes it harder and harder and harder to create a migraine. So anytime you get a chance to ward it off, those are always good days. So kind of going through the process, this is what I want you to look for. Look for a doc, and this is kind of what I want to talk about as well. We'll talk about some of the other things towards the end, but this exam process, I really want to make sure that when you guys are looking for practitioners or providers, and I'll get on a soapbox, I think there are certain practitioners that have protocols, and they have their migraine protocols. sometimes they work, but a lot of times what you find is they're trying to put everybody into their bubble or into their box or into their protocol. And that kind of frustrates me because a lot of people, it just doesn't work. I think it could be helpful, and God bless those people. They'll definitely be able to help some people. But I think when you get into the chronicity of migraines, it's a multifaceted approach with a lot of different compensatory mechanisms. So when you take a detailed history, you want to be able to say, okay, what's going on with me? How did this happen? What was the process? What is my mental health around it? Because some people can have anxiety that triggers it. People with migraines tend to have a lot of depression. So when their migraine goes away, they're almost euphoric. They're so excited, and then the migraine comes back, and they go back into a depression. Because it's like every time you don't have a migraine, you go, this might be my last one, and then it hits you again. You're like, oh, nope, it's not. So there could be a mental health component to this. So you want somebody that takes a really good exam, a detailed history, and then lab testing could be really beneficial as well. There was a case where there was a doc that was working on a concussion patient with migraines, and they did some really great work with the concussion symptoms and the concussion findings, but the patient had migraines. And so they kept going back to the doc and getting worked on and worked on and worked on and worked on. And I ended up seeing the patient, which was really cool. So I was co-treating a little bit. I ran some blood work and found out that the patient had low iron. So she was anemic. So the doc had done a great job of fixing all the brain injury components to it. But the reason why she still had migraines is because she was anemic. So, so she spent a lot of money with this doc, going through a lot more rehab over and over and over again. And I told her, today is your lucky day. Here's a bottle of iron. You should see some changes coming up. And yeah, she did really well. So her headaches went away because we found out she was anemic. So you might have to do things like blood work, saliva testing, hormone testing, stool testing, CT scans, MRIs. But finding a doctor who's not afraid to dive into those pieces could be really good, because again, there's so many causes for migraines that you have to kind of dive into this. And then going through a detailed exam, again, I don't think protocols work for a lot of people. So you have to get into, looking at their vestibular system, looking at their brain stem, looking at their brain, looking at vasculature. Some people can have vascular migraines, vestibular migraines, ocular migraines. There are so many different types that it's good to find somebody who knows how to do a very detailed examination. So I wanted to show you kind of a couple different things to look for. If you get into vestibular migraines or ocular migraines, these are some things that could be beneficial, is looking at like V&G testing, which V&G testing is where a doctor will put your eyes into the goggles and then they graph out the eye movements. And so instead of looking at your eyes going well, they seem abnormal, you actually have a graph that you can, go back to and look and kind of tease out the details and say, okay, here's where the dysfunction lies and here's the area that we're going to work on. So this is phenomenal for anybody who has brain injuries, TBIs, MTBIs, things like that. We use this all the time in our office. So to find a doctor that knows how to use this, I think is very beneficial to migraines. So I kind of wanted to mention the vestibular system, kind of show you a picture. So the little white area, over here that we're looking at, that's your vestibular system. So that's that inner ear system. And the vestibular system is oftentimes with TBIs, one of the things that's really kind of thrown off or kind of uncalibrated, for lack of better terms. And so with TBIs, you have to go in there and you have to recalibrate the system and get it so that your body knows where right, left, up, down, forward, and backwards is, as it coordinates with your neck and your eyes and your head and your brain. There's a lot of pieces that talk to each other. So if you have one major area that's off, then your body has to compensate. And we even had a case last week where we're working on a patient with head pain, and it's amazing that his balance is like 50% stable. His vestibular system isn't working very well. He has a nystagmus. So we're working on this system because if he's compensating all of these imbalances with his head, that means his neck muscle has to get tight, which then can create and feed into migraines. So we're really working on these systems, for the headaches and the head pains that he's been dealing with, for almost a year. So this is kind of example of your vestibular system. We do things similar to this called, your computerized balance testing, where we can look to see, are you compensating? So if you're constantly leaning to the left, then your body has to compensate and increase the muscles so that you're upright and, even with the horizon. And so all of these compensations can increase muscle tone, change your head position, change your eyes, and then, and impact how you have a head pain, headache, or a migraine. So then having somebody do the rest of the neurological exam is important. There's a lot of different areas of the brainstem to look at. So you can have like trigeminal issues within the brainstem. And a lot of those like pains that wrap up into the back of your head into your eyes, those can be associated with like trigeminal types of responses, which are in the brainstem. So having this ability to look at your brainstem and your eyes and your vestibular and your cerebellum and your neck and your head, these are all things that you want to find a practitioner that's good at, testing them, identifying them, putting these pieces together, and then coming up with a really good treatment plan. Lab testing. So I wanted to give you guys some lab testing, some ideas to ask your doctor as well. And I mentioned earlier that, I had that one patient that had an anemia. And so we gave her a bottle of iron and she was doing great. I actually had another case that was similar, that she was in another country doing an ATV trip, and the ATV flipped, and so she had a concussion. Well, she had migraines, and she kept seeing a doctor and then another doctor and another doctor. And so by the time that she came into the office, mom said, well, my husband's lost his job. We don't have a lot of money. We've spent a ton of money trying to figure this out. And so I said, well, let me do an exam. Let's do some blood work. Came to find out she was anemic. And so, I told the mom, I was like, well, this is great. It's great news. You don't have a lot of money, and I think the treatment plan is cheap. So I said, we're going to have her, take some iron for the next couple months. Let me retest her labs. Let me have a visit so I can look at some of the neurological pieces and give her some exercises, and we'll see how that does. And she ended up doing well. So lab testing can be very, very beneficial. If you have somebody who's not running it, it's probably a piece of the puzzle that they need to look into. So I gave you on this slide here some things to look at. So I mentioned iron and anemia. You got to look at the iron panel. So a lot of times in the medical world, they'll say, oh, no, they're fine. And what docs are looking at is they're looking at hemoglobin. And hemoglobin, if it's low, then in the medical world, you're definitely anemic. But if you actually look at iron, you'll find that there's a lot of people with low iron that are not full-blown diagnosed anemic. And so a lot of times we'll look at what's called ferritin. So ferritin is your storage of iron, and it's a marker that we like to see between 15 and 150. But honestly, I like to see probably around 40 and higher, because when you have females who are having cycles, you got to have enough reserves of iron so that when they have a period that they're not losing more iron. And so sometimes you'll actually see migraines that occur when somebody has their period. That can be an indicator of low iron. So we'll look at things like thyroid. Thyroid can cause different types of head pain. Glucose, blood sugar markers, those are things that are helpful. And then a CBC. And a CBC gives us some ideas with infections, B12 anemias, iron anemias, some other conditions that can definitely be related to migraines. So this is just a small version, but really what we do in our office is we run, a comprehensive, complete blood chemistry so that I can get a full picture of their metabolic system. And we can try to identify where the migraines coming from. Are they neurologic, or are they, somewhere else, meaning more metabolic? So what do you guys do? And that's, a lot of questions, right? Well, what do I do with this information? Where do I go? Well, I definitely want to give you things to empower you to go to your doc and say, look, I need you to do a full neurological exam. Don't just test my reflexes and then tell me you don't know what's going on. Don't just fit me into your protocols. Do a full exam and give me an individualized treatment plan. Or why don't you run some lab work? I want to see what my markers look like and see if there's anything that's contributing to this. So I'm going to give you some things on what to do. in the next few slides. And these are some of the things that we do with patients. So if I can give you some things to do, hopefully to get started with whoever you're working with, hopefully we can be of help. So brain rehab. So I put this in big letters. We got to find somebody who knows how to do brain rehabilitation, not somebody who knows how to just follow protocols. So that's probably my first, quest that you should look into. Neurologic. So things that we can do neurologically, so you have people that specialize in vision therapy. Vision therapy could be really good. Also make sure they understand more outside of vision. You'll hear a lot of things like prisms, and I think prisms can be very helpful. But I think for some people, they're also Band-Aids. So, prisms they don't necessarily fix that part of the brain. Some cases they can be incredibly beneficial. So we have a doctor in our office, Dr. Terry Trinka, who actually does a lot of our vision stuff and works with prisms and things like that. So we actually work closely with him. And even with all the brain rehab, he will end up changing the prism prescription, because if you progress somebody's neurologic function, then the prisms that they had may no longer be appropriate. So vision therapy is good, but make sure it's in conjunction with others. Vestibular therapy, like we talked about, knowing somebody who understands that fully is important. You want to look at things like the brainstem, the midbrain, and the midbrain is kind of where you get that fight or flight response. The midbrain is also where a lot of your light and sound go into. So when this system is overactive, such as migraines, this is why people become sensitive to light and sensitive to sound. So they end up, I've seen people wearing headphones, earplugs, living in the dark, sunglasses. We'll have people come in the office with earplugs and really heavy sunglasses. And then you want somebody that looks at that limbic center, because there's different like anxiety. When you get into this fight or flight and anxiety types of events, these can also trigger these migraines. But on the flip side, migraines can also trigger these systems too. So these are some of the areas that I would say look at support. And these are some of the areas that we definitely look at all of these areas, but these are some of the areas that we find are the most common for helping people neurologically. Mental health. Mental health, I put this in here, actually took it out and then put it back in because I was thinking, mental health is big. There's a lot of people when you get into PTSD with your traumatic brain injury. So people with TBIs definitely have PTSD. The stress of your life changing, the anxiety of not being able to do the things that you could in the past. All these things definitely change and alter how your brain works and how sensitive you can be. So looking at things like counseling, mindful meditation, deep breathing, prayer, reading the Bible, whatever things that are kind of in your wheelhouse or your life, your religious beliefs, those are things that could be incredibly helpful. So in our office, we use Jake, for that quite a bit. He's our counselor. If you listen to these Tuesday webinars, he's doing them. So once a month, we're all doing webinars for you guys on Tuesdays so that you can have as much education as possible. But, Jake is really big into, looking at the PTSD and anxiety and helping people, get kind of back some of these pieces that they lost and give them tools to work through it. So, find somebody who's great at mental health. If you're dealing with PTSD from your traumatic brain injury, EMDR could be a really beneficial piece. So look into EMDR. That could be something that you would, find very helpful. I threw on here dietary changes because I think a lot of people forget about this. We see a lot of TBI survivors, that are just don't eat very well, and I think this is something that you have to remember from a migraine standpoint and from a TBI standpoint, that you have to have good fats, good protein. You have to eat clean. You need to make sure your blood sugar is stable and you're not on a roller coaster. So if you're drinking, sodas, that's not great for a brain injury. If you're having artificial sweeteners, if you're doing food colorings and blue dyes, red dyes, processed foods, these are not healthy for your brain on a good day. So to have a brain injury and then to put inflammatory foods into your body just doesn't make sense. I know it can be tough for some people, but there's things that we can control and there's things that we can't. And one of the things you can control is things that you put in your mouth, and so this is a big piece of what we work on with people that have brain injuries in our office. Supplements. I want to give you a couple supplements. This is something that's, we can get into a whole world of TV supplements that are good for brain injuries and brain inflammation, but I want to kind of give you some things around migraines. So kind of the three big ones that you'll read out there is feverfew, riboflavin, and magnesium. And there's actually supplements, there's actually some combinations of supplements. When you look at migraine-based supplements, they actually will combo these. The first time I learned about it was in MD that I was talking with, and he used a compound pharmacy, and he would do high dose of feverfew, B2, and magnesium. And then there was a company that I utilize. I lecture for Apex Energetics, and I was looking at one of their products called Neuro O2, and I was like, oh my gosh, this has all three of them in there. So sometimes I'll use these three for trying to abort a migraine or try to prevent a migraine. And if it works, that's phenomenal, because a lot of people that do suffer with migraines, they're only allowed 9 abortive pills a month. So if you have more than 9 migraines, then you've used up all your medication. And so even in that world, it gets super crazy that I know people that for their birthday, other people that suffer with migraines give them extra pills. So people with migraines start to stockpile these abortive medications. So if you can find something like these three, it could be something very beneficial. And then I put CBD. CBD is always worth a shot. For the majority of people and almost everybody I've ever met, CBD either does something good or it doesn't do anything at all. So it's usually a good one to try, and if it works, that's phenomenal. And if it doesn't, then you just kind of move on. So definitely try the CBD. There's so many different brands out there now. There's different combinations. There's different seed types. It definitely gets a little bit confusing with CBDs out there these days. But there's a lot of things to look at. So do your research and try it. If it works, great. And then I put structural support. I didn't want to pass this up because we talk about brain injuries and we talk about the neurology, but there is a structural component to this as well. One of the things, chiropractic does really great work. So, so I have a chiropractic degree as well, and you see some really cool things. I think there are some chiropractors that's the end all to be all, and I don't think that's the case with migraines. But what you do see from TBIs, people that have concussions, brain injuries, auto accidents, they tend to have a lot of compensation in their neck. And with this compensation, that's what can also then trigger these migraines. So to work on the cervical spine, to work on those muscles, there's an occipital nerve that goes up the back of your head, and we'll actually use like it's called Prologel. We'll use like Prologel with lidocaine, and we'll work on those areas and get that pain to shut down and quit being so sensitized. So you can do some really cool like cranial sacral work. There's some really cool stuff that you can do to support the structure, but if it doesn't work, then you got to move on. And this is why it's kind of nice to find somebody who has all of these facets. And there's a bunch of doctors out there. You just have to find them or reach out, and we can help you with that as well. So in conclusion, so it's good to figure this out sooner than later. It's never too late. And I think with concussions, a lot of people think, well, I've had these for 10 years, there's nothing you can do. And that's not true. I've had a handful of patients over the years that I just could not make a dent, but that's over the 17 years of being in practice. So, every patient, usually you can make some change. Can you get 100% resolution? That could be hard, but if you can go from, 5 migraines a week to 1 a month, that's pretty amazing. Or even 2 a month, that's pretty amazing. So when I first started working with migraine patients, in my head, I was trying to think 100% resolution was the best. But then the patient started reminding me that, if I can go to work and be with my family and function, that's a success. If you can get it so I'm not living in my cave every single day, that's a success. So success is different for each person, but there is a possibility of making a dent. So, definitely look into it, and you don't have to suffer all the time. So in the article, I put this, the very last paragraph, I put, while concussions and TBIs can be devastating for patients and their loved ones, it's important to remember there is hope. And I think this is the case with a lot of these conditions. There is hope. It's easy to not have hope. It's easy to be discouraged. It's easy to have those waves of reality that slap you in the face and tell you, hey, by the way, you have a brain injury and you have a migraine and you can't function and you can't work. I mean, it's definitely super easy, but there also is some hope. We have seen people who, have been, pretty bad off and been able to make changes. So lifelong suffering does not have to be the way that the story unfolds. The brain's an amazing organ, and with the right treatment team, therapies, nutrition support, the brain can be rehabilitated to optimal function. So I believe that's always a possibility. And when I work with patients, I have that mindset until I can no longer push any farther, but there's always resources out there. There's a lot of great people out there. So I think there's always hope. It's just trying to figure out who these people are in the middle of a crazy world. So I wanted to throw out some different resources. And so we're going to have, increase our resources over time. But, one of them that's on Facebook, if you're not a part of this group, is probably one to go search out. But it's, Amy Zelmer. She has a TBI Tribe. And so there's a lot of people on there with a lot of information. It's a tribe. It's a lot of other people who are struggling and suffering. And so sometimes it gives you an idea that, hey, you're not the only one out there. There's a lot of people very similar to you that are trying to find the answers and trying to get well. So it's nice to have a tribe. The Brain Health magazine that we wrote this article for. So it's a good magazine to subscribe to and to have on your shelf, something to read. You can get hard copies, digital copies, but it's good. It's something I think you would enjoy. Another person here in Denver that we've done some stuff with is Joanne Phillips with Empowered Through TBI. So she's another brain injury survivor. She's tried to bring some resources to her community. And so we've been working with her over the years, trying to do some cool things. And then our clinic, Integrated Brain Centers. So we do a lot of brain rehab. It's a passion of ours, and we have a very holistic, comprehensive approach to that. So there's a couple of resources for you to check out. And then also too, we do Tuesdays webinars. We're bringing this to you guys for free, so you just listen. We also have a radio show, so on the radio show, you can listen to each of us. So once a week we're on there, and on Mondays, and we're doing a half-hour subject, and usually we're kind of doing them based on the webinar. So, yesterday I talked more, about the migraines, on the radio, and, kind of led into today's discussion, but it's just different. So every time we talk about this, there might be something that you can grab. So, if you want to tune in online, you can definitely do that and live stream it and listen to us on Mondays. Then we do our webinars on Tuesdays. Check out our blog on Integrated Health Systems and Integrated Brain Centers are our two websites. Under Integrated Health Systems, you can actually sign up for our newsletter. You can read our blogs. There's like 47 pages of blogs. So you can go on there and pull down articles and read them. And so we're trying to give you guys as much information as possible. So I hope you really, really enjoy it. And then we always do telehealth. So you can schedule for a free consultation. We can do it via video conferencing. We can do it on the phone. We can do it in person. So whatever works the best for you, but those options are available if you need our help or services. So we do free 30-minute consultations. There's the phone number there. So it's Integrated Health Systems and Brain Center. That is who we are. You can do a consultation with Jake, Dr. Maynard, myself, and we're all here to help and do the best we can to serve the community. So let us know how we can help. It was a pleasure again on Tuesday evening doing our webinars to you guys. Tune in next week. Make sure you go to our Facebook page, Integrated Health or Integrated Brain Centers. Go to our Facebook page and you can sign up for our newsletters, and you can even register for the next webinar. Each of us are taking turns every Tuesday and giving you some more information and education out there. So I hope you enjoyed it. I hope everybody, stays safe and enjoy the rest of your week. We'll talk to you soon again.